Hi guys, this is Tavishi Dogra and you are watching thehealthsite.com. Today we have Dr. Imran Hamzawala. He is a gynecological robotic surgeon at Sefi Hospital in Mumbai. Many people are not very familiar with the robotic surgery. So, I would ask you to please briefly explain how it works and how what are its role in the gynecological issues.
All right, Avishi, thank you for having me, and welcome to the viewers who are viewing this session. Uh, robotic surgery. I think when we use the word robotic surgery, I think we need to be a little bit careful because it sends the message across saying that it's the robot that does the surgery, which is not the case.
Yes.
Okay. So the first thing I want to be clear is that the correct terminology to use would be robotically assisted surgery. So we are using the robot as an assistant tool to allow us to operate. So the surgeon, Tavishi, is always the surgeon. The surgeon knows what needs to be done, what has to be done in the best interest of the patient. And we are using robotic technology as a tool to operate. So I wanted to be very clear about that. And also to our viewers, I want to make it very clear that the robot is not autonomous. It's 100% controlled by the surgeon at all times. The move of surgical practice towards robotic surgery is to try and mimic that aspect of bringing precision and efficiency within the surgical practice, because we know for a fact that if you bring precision and efficiency in surgical practice, it will always translate into good patient outcomes. So hence the reason is that robotic surgery is coming in a big way, and I'm so glad to see it's coming in India in the way that it is. That our focus is purely going to be on improving surgical outcomes for our patients, and getting them better and up on their feet as quickly as.
So, doctor, what advantages does the robotic surgery offers as compared to the traditional surgical methods that we had?
Robotic surgery, the biggest advantage that robotic surgery offers is that it gives our surgeons, Tavishi, the gift of vision. Okay. So the biggest limitation for us is that if we have human eyes, now what the robot does for us is that it magnifies that image 10 times. It's three-dimensional. It's high definition. So it's given me the gift of vision. As a surgeon, jo mujhe kaam karna hai, if I get the best vision possible, I'm bound to do a better job in terms of purely the gift of vision. But it's not just about the gift of vision. It also gives us instruments which bend at their tips. Okay. So in laparoscopic surgery, if I don't know whether I'm able to demonstrate this. In laparoscopic surgery, my instruments could do this and they could do this. But in robotic surgery, my instruments can do this. They can do this. But more importantly, the tip of my instrument has got a wrist. The advantage of giving the wrist to the tip of your instrument is to mimic the ability of almost as if you're using your hand inside the patient, by using the technology. So what that does is that it allows us to do precise things in very difficult areas in a very, very efficient way.
As a leading, robotic surgeon, please elaborate, specific, gynecological conditions,
Yeah.
robotic assisted surgery. I would not
Sure.
do robotic surgery.
I love that. I love that. You're catching on. That's very good. That's very good.
So the robotic assisting surgery, has
Yeah.
shown benefits.
Robotic surgery, because of the way it is, I feel that the advantage of the robot, the true advantage, is in complex procedures. Jitna difficult patient ka clinical condition, utna zyada faida doing it robotically. Okay, because we are using modern technology to achieve a more difficult, difficult problem mein acha outcome.
Could you share some success stories, with us? The positive outcomes, obviously, like your experiences.
One particular patient in mind is who had a very complex procedure, and I spotted her. She sent me a picture, and also which she posted on Instagram, where she had a wonderful dinner experience in a beautiful ball gown 4 days after surgery. So these things were unheard of. I also had another patient of mine who sent me beautiful pictures saying, "Hey doc, less than 1 month after my surgery, I'm trekking in Leh and Ladakh." So these are fantastic things. I've had patients who've sent me pictures, of holding their babies, saying that after your surgery we did get pregnant, and this is a fantastic outcome. So there are patients who've suffered with pain for a long time, and after having done these surgeries, they're pain free and leading some wonderful, wonderful lives. And I always pray and wish well for my patients, and I hope that we continue to do this and provide such happy outcomes for so many of our patients.
Thank you so much, Dr. Imran. I mean, our audience will definitely go back, home with such valuable insights.
Thank you so much, Tavishi, for having me.
Thanks a lot for joining, Doctor. Thank you
It's
so
my absolute pleasure. Thank you so much for having me.
much. Thank you.